Okay, I'd like to welcome everybody to the special meeting of the Pelham Board of Education of September 11th, 2020. Would everybody please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, this brings us to item 1.3, which is the superintendent's report and update. Dr. Champ.
Good afternoon, and thanks to everybody. Please let me know if you have any trouble hearing me. Sometimes my laptop doesn't always pick up audio the best. But thank you so much for coming and for assembling so quickly. I know that certainly the board is very much aware of the concerns that we've been dealing with these last couple of days. And we had a good conversation on Wednesday evening, right on the cusp of having to have made the decision to shut down in person and shift to remote for a couple of days. So we have been working aggressively over these last 2 days to find the best path forward for the district, recognizing certainly the physical health and safety of our staff and our students. Also at the same time, recognizing the social and the emotional and the academic needs of our students. Our commitment from the beginning has been to get back to in-person instruction. I know we've all been missing our students. We've been working again aggressively through the summer to be ready and to get to the cusp of that point, and then have to make that shift was really painful and difficult for all of us. And I just want to again acknowledge that I recognize that it was a difficult decision to make, recognize the difficult position that put parents in, and the difficult position that it put our staff in having to shift so quickly. So, I just again want to extend my appreciation for everyone for understanding that really we're trying at all times to do what's in the best interest of our students. And there's times where physical health is going to have to sometimes be that first line priority. So the decision to make that shift really was to give us time to assess the situation, to gain more information about what had happened, to have the time to thoughtfully work with the Department of Health, and then again to decide to really determine what would be the best path forward to get us back on track to getting our kids into school. That's been our commitment from the beginning, and it continues to be our commitment. So I think I'll just kind of dive right into updating the board on where we're at, starting with the elementary and middle school level. Our thanks to the administrators who have been working on the investigations collaboratively, both middle school and high school, to really try to identify who was at the gatherings that have happened, because that is a crucial piece of determining what is the scope of this. And that's, again, I should add, part of why we went with a full K-12 shift to remote learning, was because we didn't know the scope. We didn't know if it would impact siblings. So the abundance of caution led us to make that K-12 decision initially. So in reviewing the information, the investigations that they went through, at this point, we have determined that it was, to the best of our knowledge, only high school students in attendance at the events. And in our conversations with Department of Health, given all the facts of the circumstance, the events and gatherings that happened, given that we believe at this point it's only high school students, they've indicated that there really is not much risk then to siblings. So with that, my recommendation going forward is that we plan on Monday that all 4 elementary schools and the middle school return to in-person hybrid learning effective Monday morning. So that being the case, certainly it was planned to be a cohort A day. So cohort A would report instruction on Monday and Tuesday as planned. And they are in this upcoming week scheduled for in-person on Wednesday as well. This will be our first early release Wednesday under the hybrid model. Cohort B on those days, of course, will attend their classes from home. Then cohort B will report in person on Thursday and Friday. One more piece I would add, and I thank the PTA Council again for and the PTA leadership for their partnership in this process. We were fortunate, a couple, Jessica, Eileen, and Leah and I were able to attend PTA Council meeting earlier today. As many folks know, if they attended our presentations leading up to the opening of school over the summer, in selecting the model that we did as a district, one of the big pieces of feedback that was presented to us in the spring was parents understood it's going to be difficult, it's going to be complicated, no model's going to work for everybody. But there was a strong theme at that time of whatever you do, please just try to put my children on the same type schedule so that it'll help us to plan for childcare, older children helping younger children, et cetera, which is a big piece of what leads to this district-wide K-12 AABB cohort plan. But contingent within that was we knew was going to be an added need for supervision during lunch. So, we've been talking with the PTA leadership through the summer about that. And then as these last couple of weeks towards the opening of school have come up, that's the time where we finally had students in classes. We could release the names to start to gather volunteers to assist with lunch. So I don't know if folks realized.
Sorry to interrupt. This is lunch at the elementary level.
I'm sorry. Yes, thank you. Lunch at the elementary level. And part of that comes from just a quick logistical piece. We've cohorted students at the elementary level. We're at 50% capacity at the elementary level. So as folks probably recognize by now, the plan is that students attend all their academic classes in the classroom, specials come to the classroom, and as well as that lunch will be served in the classrooms. So that requires more supervisors because instead of being together in the cafeteria, students are distributed across classrooms, and then same thing applies for recess. They stay in those cohorts as they go out to recess. So there's definitely an increased need for supervision. So Jim Rickey's office has been actively and aggressively working through staffing all summer, daily basis, recruiting monitors. And as the board is aware from our prior board agendas, we've been appointing many people. We've also unfortunately been experiencing a lot of resignations from those positions. It's an hourly position. It's only an hour and a half a day. So we've been having some trouble accruing the size staff we need. We knew all along we were going to need parent partnership really to supplement those gaps. So I raised that today just to make parents very aware that we very much are dependent right now on their support and volunteerism to fill those gaps, especially as we're planning to reopen the schools on Monday at the elementary level. So I know it's been in PTA newsletters. I just wanted to really specifically bring that to folks' attention because we are still in need of folks to fill some gaps, both in the immediate for next week, but also looking for folks that can commit to that on a regular basis, potentially for the long term while we continue to do our due diligence to try to fill those monitor positions. So I think that's an update on where we stand with elementary school and middle. I want to take a pause there and allow, for the board to ask some clarifying questions in case I missed anything or was not clear.
Somebody have something? I was just going to say my phone's blowing up with elementary and middle school parents saying that they're thrilled by what you've just said. So.
Good. Good.
I have a question, I guess, related to the monitors, just to understand the issue. Do we have a strategy if we don't have enough parent volunteers, or, are we going to get there? I'm just wondering.
I think based on our meeting earlier, we're there at 3 out of 4 buildings. We're really just looking for probably another half dozen folks that might be able to step in for next week. And certainly, the assistant superintendents and myself have already penciled in a lunch hour at the elementary schools to pitch in and help out.
I was going to say, sign us up. We'll be there.
Okay.
Cheryl, I also wanted to say that for your question, Jess, a lot of teachers have stepped up to stay in their classrooms during lunch and help out. We're very, very grateful to them for doing. So that takes a little bit of the need down. But I think after the call, I felt confident that we'll be able to do it. The issue will be sustaining the volunteers long term. So when the link goes out to sign up, if people have a day that they can do it or a couple of days, sign up for as long a period as they can, to cover as much of the time in the semester as possible. But I agree with Dr. Champ. I think it was looking good.
I have a question.
Okay, go ahead.
It's just a logistics question. So if someone has a child in Colonial, for instance, and there wasn't enough coverage at Siwanoy, just as an example, presumably they could then volunteer at Siwanoy even though the child is at Colonial.
Yeah, and that actually that we may need folks to exercise that flexibility if they're able to, because I said 3 out of 4 were in good shape, so yeah, it would help. I mean, in the ideal world, we'd have parents right in their own child's class,
Right.
would be committed, to that cohort in that class for a period of time. But certainly, we know that that's not always feasible just because of the limitations people have. They want to help and they're being incredibly generous. But sometimes they don't have the,
Well, it could also be people who have children in the high school, for instance, and have time on their hands and might want to volunteer in one of the elementary schools.
Absolutely.
So, there's I think a lot of circumstances where people might be going into a building where they don't have a child.
Yep. Yes. Yeah. And I have to say, I appreciate Pelham Together is also stepping in to help us solicit volunteers as well. And I think, John, to your point, it's folks who have expressed, whether they're even out of the school district at this point, just a willingness and a civic duty to go above and beyond and help where there's a need.
There's another opportunity for the Pelham community to come together as we did this spring. People were making masks, people were doing grocery runs, people were helping to support our downtown. It's not unlike that. When I listen to the building principals and PTA presidents and PTA council speak today, I mean, this is good. This is a big ask. There's a lot of people that we need to bring in each day for 4 days of lunch each day. And it's really the only option at this point. So I think it's a great opportunity for people to give back their time, and it's an hour of their time.
I also wanted to say that it's completely open to college students who are home, if there are any. You don't have to be a parent.
Great call, Eileen. That's important to know.
Also, for those college students who might like to get paid, they could go through the fingerprinting process via Jim's office and get the monitor's salary. It's a nice pocket change while they're home.
Yeah,
that's an option as well.
Yeah, we would very much welcome that.
So this begs the question of more outside people in the buildings.
Yeah.
So we're going to have any monitoring program in there to make sure that all the volunteers who are coming in are not bringing anything with them or not taking anything out.
It does, and the guidance really talks about trying to minimize to the greatest degree possible. And I think we have to recognize that there will be some limit to that. Certainly folks will be expected to, hand hygiene, masks, same protocols that all staff would be expected to do. Principals will be training any volunteers before they start work. We also will be screening them through the, it's the same, I think is it Jim, the Raptor system that we use at the greeter station where, driver's licenses will be run and scanned to make sure there are no custody issues, sex offender issues, et cetera.
Yep.
Yeah.
Okay, that's good to know.
What about, I know it's a hard ask to have all the students have their temperatures checked, but given that we're talking about perhaps bringing 14 people in, we did talk at the meeting earlier about the logistics of having that greeting opportunity move as quickly as possible, have like a pre-screening, but is there a way, I know it adds another step in the process of having a quick temperature check of those people coming in each day?
Yeah, it's actually required of all visitors.
Oh, great.
Already.
Okay.
Yep,
Great.
and that'll be daily. They have any visitor to the building. We're only allowing visitors on school business, which certainly this would be considered school business. They'll be required to have their temperature taken and to fill out the health attestation and questionnaire. And it's the typical things that we're all getting everywhere we go now about have you traveled, have you been exposed to anyone? Yeah, so that's definitely required.
Good. Sounds like a plan.
All right, so elementary, middle school, get those first day clothes in shape, and we're looking forward to seeing you guys very much. Certainly we'll continue with our kindergarten screenings as scheduled. And at the moment, we're planning our first day for kindergarten as scheduled prior. That would be Wednesday, the 16th will be the first day for Ks. Okay, so on to high school. So certainly this is a much more challenging situation given where we are. While our investigations certainly have determined the identities of some of the participants who attended some of these recent social gatherings, and it's been multiples, we're unable to ascertain all of who may have attended. So at this stage, after going through the investigations, knowing that we're dealing with somewhat of a large group of students, and also after consulting with the Department of Health, and understanding the disease and the potentials that come from large events like this, and understanding the incubation period of the disease itself, should it be present. I'm coming to you with the following recommendations, certainly for your discussion at this point. What I would recommend is that our high school students in the health department certainly said they were in agreement with supporting a recommendation in this direction. Continuing to learn remotely through Wednesday. Let me just make sure I get this right. Okay. So our high school students continuing to learn remotely, all of them through Wednesday, September 17th, this coming Wednesday. And of course, the bell schedules are all online. It's important to note, if we do go down this path, that the high school students learning remotely would need to use the hybrid bell schedule. The reason for that is because if we're bringing our middle school students back in person, they'll be using the hybrid schedule. We have a shared facility and we have shared staff. So in order to keep our staff and our facility functioning in the puzzle that is a master schedule, we're also going to need our teachers to teach on the hybrid schedule, even though the high school teachers are teaching students remotely at home. So it's a little complicated, but in essence, anytime that facility is open, even if they're on two different plans, we have to follow the hybrid time schedule, just so that the master schedule will continue to work. So again, my recommendation is that we continue for high school full remote through this coming Wednesday, but with a caveat. In an effort to protect the health and safety of our students and staff, given the unknowns of these events that have occurred, and certainly wanting to prevent some of the issues that we've seen at colleges and other places that have had similar events. I'm recommending that we require all high school students to be COVID tested prior to the return to in-person instruction, which we would like to begin in the hybrid model on September 18th. And again, that caveat being all students being tested. Students would then be required to produce a negative COVID test result to us in order to return to school with their cohort. So cohort B would be the group that is assigned to return in person on the 18th. Cohort A would, of course, begin in person the following Monday as they're scheduled. But we would be requiring a negative COVID test result to be provided to the school in order for all students to return. We recognize that is potentially a burden for families. So part of our meeting today, and what I wanted to share with you now is Jim and I both have been in touch with a variety of different testing companies. And we have procured, and thanks really in large part the help of County Executive George Latimer, was really crucial in helping us to connect with Westchester Medical Center. They do have they can arrange on-site testing for us as soon as Monday, this coming Monday. So we can provide testing on site on the high school campus for all of our high school students, scheduled over Monday and Tuesday of next week, with stragglers on Wednesday as needed. So we are, if the board is amenable to this plan moving forward, we'll be seeking your approval to move ahead with approving that testing. It does come at a cost. The testing, certainly, we would ask parents and students to provide insurance information, because the billing first goes through family's insurance. The district would assume liability for anything that is not covered by insurance. It's hard for them to give us a specific amount as to what that would be, because everyone's insurance is different. And, Jim and I can speak a little bit about the conversations and groups we talk with. But we'd be seeking approval to make an agreement with them, bring them in to do the on-site testing over Monday, Tuesday. And the turnaround rate that they're getting with their labs is 24 to 36 hours. So the concept would be bring cohort B students in for testing on Monday, because we would then likely get their results as soon as Wednesday, ideally by Wednesday, so that they could then return to school on Thursday. Cohort A could test on Tuesday, knowing that we've got until the following Monday before they return. So for those who don't want to participate in the school provided testing or unable to, certainly we'll have resources that you can go anywhere in the variety of testing sites in the county for free. Those certainly would be available. We would accept written results from any of those locations as well. One crucial ask that we have is that the testing be administered as of September 13th or later. And that's because of, given when the events occurred, 5 days until generally it's able to be picked up by testing. We want to be sure that the appropriate amount of time. And then, of course, any student or parent who chose not to have their child tested, they certainly have that right. But then we would require that they complete the 14-day quarantine on full remote instruction, and they would be allowed to return September 24th. Covers the basics. So I'll pause there again for questions.
I have a question, Cheryl. So let's say I'm a parent of a 9th grader and I know that my child did not participate in any of these events. And I feel that it is burdensome for my child to have to go through testing. What's the response from the district?
At this point, given again that we don't have a full scope of who has participated in various events, we know there were students in all grades at any given point in time. We really feel the sense of responsibility to everyone, staff and students, that we have to require everyone to test. The good part is that this gives us a baseline for all students, that we can safely assure all students walking through our doors are not presently, as of the testing dates, carrying the virus. Another crucial piece, I guess, that I would add to this that I think will help prevent us from getting into the same situation, because I know that's another big question on people's minds, is we also, as was discussed at the board meeting on Wednesday, we're in the process of developing we'll call it a compact or a community agreement, commitment, whatever we want to call it, similar to what many colleges are doing. I think this was raised by members of the board even, where we outline the expectation of what the public health responsibilities that we all bear as community members, as a school community. And we're going to ask families and students to commit to that, so that in the future we do not have to be in this kind of a position, because I think we all know the reality. There will be gatherings. There will be things that happen from this point on, and we can't shut schools down every time this happens. Testing everyone gives us a clean baseline as a starting point. Putting a compact and agreement in place then gives us a tool that we can now use. And again, we all need to trust one another to a degree in this day and age. Parents trust us with their children. We have to trust them to be honest with us about their health. No judgments, no punishments, but just a common commitment to doing what's in the best interest of the health of our community. So with that tool, it'll be a commitment to, if somebody's traveled to a state that's on the travel ban list, they're committing to following the governor's guidelines of quarantining for 2 weeks. Child would remain on remote learning. If we discover a child has participated in an event similar to what we're dealing with here, and we have evidence that they were there, then we will not permit them to come back into the school until they do their 14-day quarantine. So something that can work both ways as a tool where we can be much more targeted about who we're dealing with and why, and not have to put ourselves and our students and our families back into this position of a whole-scale shutdown for the actions of a relatively small number of students, given, percentage-wise, the whole building.
I think that's
Cheryl,
because it sets out the expectations and consequences very clearly, so everybody knows ahead of time where we stand, where they stand, and emphasizes that we are one community responsible for each other. So thank you for that.
Cheryl, can you elaborate a little bit on sort of the details of, so the kids will be tested on Monday. Will the results go directly to the school? Will they come to the family? How do we then prove?
Yeah. So Jim, feel free to chime in. I know you've had an extensive conversation with the folks too. My understanding from my initial conversation was part of the registration process and paperwork that will be filled out as students come to be tested. And I should say Westchester Med has done this work with colleges, with other schools. So they've got a pretty standard, solid approach. Part of that will be a release of information so that the results can be released directly to the school, which will help just to facilitate the whole process and make it much more seamless. Certainly, I think that'll be a parent choice, of course. So I think my understanding is results will be released to parents, and then if they give a release, the results will also be released directly to the school. Jim, any other color to add to that?
No, I think you really touched on those points. They said they would share that paperwork with us as soon as possible so that we'd be able to make that available to, of course, to families to hopefully get that taken care of on the early stage so we can get this process moving if we move forward in that direction.
And Jim, how did you, I know that you were in touch with several vendors today. How did you hone in on which vendor to go with that you're proposing to us next?
Well, looked at a couple of different things. Certainly, we all know that the state, we went to the state website with Department of Health. There's a number of testing facilities nearby. So we have 2 in New Rochelle at Glen Island and at Montefiore New Rochelle Hospital. There's also 2 locations in Mount Vernon, and there's a drive-through facility in Co-op City. Those are all free sites where people can get tested at any point in time. They have to make an appointment through New York State on their 800 number. The difficulty in that situation is their average turnaround time is 5 to 7 days. So as you can see right there, that created some difficulties for us. We also, throughout this entire process, we've been working with our health insurance company, Quest Laboratories. I had a call with a representative from Quest Laboratories today. Their pricing was actually more expensive than the pricing that we were getting with Westchester Medical Center. And they weren't doing testing for minors. So again, that knocked that out. I started contacting another vendor, and their business is really more in tune with surveillance pricing or surveillance and continuous testing, and not just a one-shot testing, which I think is more of what we're talking about right here. They're looking to get into the, we'll test now, we'll test every week or every other week type of a scenario. And they really were not interested in a one-shot type of an instance right now to mobilize for that. So those are kind of the people that I looked at and the scenarios that I looked at. Again, looking at the pricing, certainly we know Quest is a national laboratory with access to getting good pricing. So being able to compare this particular instance to Quest, I think that helps us know that we're in the territory of competitive pricing.
This is kind of related, but would we open up this testing to staff as well?
I don't know that we're in a financial position to extend that far at this point. I think we would encourage staff to make use of the local resources that are available.
Okay.
I have a follow-up question on permissions. So the parents will receive the information directly, and if they sign a waiver or permission, information will be simultaneously sent to the school district. But in any case, in order for the child to come back to school, they have to present some written verification that they were tested and they're tested negative, correct?
That's correct.
So for the sake of the parents, I would urge them to sign the permission allowing the lab to report directly to the school just to make things more streamlined. And to make sure there's no gaps in the way things are reported. That's obviously a personal choice, but I think it's clear that if they report directly, there's not a chance of things messing up. I would hope.
And is it true that if people choose to test at a different site, that there's a means for them to bring some kind of printed proof, documentation?
Yeah, that's my understanding of having gone through testing myself over the summer. Yeah, I believe everyone, once the test results come, there's a documentation that you're able to provide.
Yeah. So they would just need to bring that or have their child bring it if their cohort be on Thursday or on the following Monday. So just a logistical question. So in this scenario, school would be closed through the end of next Wednesday and not open until the Thursday, right? So there would be no Wednesday classes. Because I think you said the test results would be coming back in a best case on Wednesday.
It would be a hybrid half day.
Yeah, so it'll be for the high school. It will be full remote Monday, Tuesday, Wednesday.
Yeah. Okay.
Following the hybrid bell schedule, but still full remote, and then we would open hybrid Thursday.
That Wednesday was not a coming back into the building day. That was happening on Thursday. Okay.
Correct.
Thank you.
Cheryl, could you speak about what the protocol would be if there is a positive test?
Yeah, that's going to be the tricky part, which is why I will say our goal is to open in person on Thursday in the hybrid model. And this is where Julia becomes certainly our lead person. Certainly, should we find a positive COVID result out of this, that would then trigger the contact with Department of Health and the start of contact tracing. Julia, do you want to just again remind a little bit of what that process is?
So I think what's going to be challenging in this case is because the test result is going to the family. It's not coming to us. And so we wouldn't know about it. So the family will be told that the student is positive, and then contact tracing for Westchester DOH will be contacting the family for their own contact tracing. If they decide that they need our support, then they'll call me. But unless the family lets me know or DOH actually lets me know, we wouldn't know because typically that's not what happens.
Right, unless the family signed the release, that then would also.
Right.
Yeah, so and we could that may expedite it, kind of to John's point. If we get notified of a positive result as well, then we can make that initial DOH contact right away as well. But yeah, that could lead, that then would initiate contact tracing, since this, again, you never know where you're going to pick up, where people pick up the virus. They likely, certainly the DOH would recognize the purpose of why we're doing this testing, and that would likely lead to, those individual private conversations with the family, since it was not at school. Since it wasn't, I rephrase that, since the students have not been at school yet, likely that contact tracing would involve outside of school activities. So we would probably not be too involved in that. But it could, the resulting, I guess the results of that really generally are quarantines. Julia, is that correct?
Yes. So anybody who came in contact with a positive person would have to quarantine for 14 days. And the person who tested positive would have to be isolated for 10 days.
Dr. Champ, with respect to how the high schoolers are going to be brought in for testing, are they signing up? Are they being notified? How does the scheduling work?
Mr. Berkowitz is actually walking the facility with the testing folks as we speak. So they're working out the logistics of where it'll be set up. If we could do it outside in tents, or if it needs to be inside in a, maybe like in the gym or somewhere that's close to an entrance. We want to try to minimize certainly traffic in the building. But once we have a sense of logistics, then he will put together likely a staggered schedule. Because again, we want to socially distance while we're waiting for testing, et cetera. So more information will be coming from the high school specifically about a schedule for testing on Monday and Tuesday, time assignments, as well as we're hoping by Monday to have the compact, that community compact drafted and ready to go out to the community. And that's actually one piece that I was looking for the board's thoughts on about the compact. I know right now we're focused on high school, but we're looking for thoughts on whether that should be really something that the entire K-12 school community commits to. Thinking especially about travel out of state and other large gatherings that could happen, not just the one that we're dealing with now, but others. Versus as opposed to just focusing on the high school students. Our initial thought was a K-12 commitment, given the nature of it. But I certainly would want to pose that, for board thoughts on that too.
Well, I think that I just want to say that if we go ahead with K-12, which I think is a great idea, I think we have to be very, very specific as to what the expectations are, because my understanding is that, there are rec soccer is happening. There are some events that are being, put
That
out
are
by
properly sanctioned, right?
Right. But I think we need to be very clear about the numbers of people and, what the expectations are with respect to behavior, et cetera, so that we don't run into a situation where people are doing things unknowingly that break the contract.
Yeah, agreed.
I mean, because the phase that we're in could be a moving target throughout the year. I wonder if there's a way of just referencing some of the language that the governor uses, and then providing a link for, it's obviously the onus is on our community members and students to keep up with whether you can be with 50, at one point it was 25 people outdoors, then it became 50, so that's going to be a moving target, and we don't want to lock ourselves into a certain, just reference some of those guidelines that are in place.
So, and I guess the explanation when we send this out will have to be made clear to parents that it's really this is a family contract. It's not just a student contract, because to your point, Cheryl, with travel, the entire family is implicated. So, and with elementary students, some of them may be able to understand enough to sign, but their parents will have to be understanding of what we're asking as well. Right.
That point can't be emphasized enough.
Right. And to that point, I was wondering if Julia could clarify again. I think you've said it before. What happens, I know with working parents, if they have to travel and they're coming back, how does that going to impact their children?
If the child stayed here and only the parent went to one of the 35 states, I believe now, and came back, the parent has to quarantine, but the child can come to school. Obviously, if the parents start showing symptoms, then that's a different category. But as long as they're asymptomatic, the child can still come to school. But if the child travel with the parent, then they both have to quarantine.
All right, thank you.
So, and Cheryl, I guess you'll be having conversations about trying to, in addition to setting out what the expectations are, very clearly explaining what the consequences would be for a breach of the compact.
Yeah, and I thank you for raising that. I think largely, basically, the compact is going to be, I'd say the broad brush consequence, for lack of a better term, is that the students will be shifted to remote learning for an appropriate period of time. Again, if it's like a travel issue or an issue like we're dealing with here, where a significant number of students in a situation that is unsafe, presents an unsafe situation, you'd likely be 14 days of remote instruction. It's not meant to be necessarily punitive. I think that's important to say, especially when families are living the lives that they need to live, and there may be times where Maybe they have to go visit grandparents in another state.
Right. That's what I want to emphasize.
know,
I mean, I know it may feel like a consequence to certain people, but I don't want it to be, I mean, I don't want to be in the business of us policing people's behavior, but more just being aware of how certain behaviors may impact our ability to operate as a school. So more just like using the word of like choice,
Yeah.
and this is where the beauty of having the hybrid model and those wonderful cameras that John got installed in the classrooms do come in place because, and handy because, should a child get a cold and have to stay out for a day, they're not
They can still
missing a day
attend.
of school like they would have before. And this is the same.
Yeah. So I'd say it's largely a natural consequence of the choices that we make. Natural consequence of that is that you stay home and go to remote instruction. I know some other districts are going down the same path as well. And I would say certainly if there's a repeated intentional violation, that would put us potentially into into a situation where we may want to look at shifting a student to long-term remote if they're continually doing something that's going to potentially endanger the in-school community. But we'll lay that out in the contract.
So maybe some of it is semantics. It's actions and results instead of
Consequences, right?
So just another thing I wanted to follow up on, because I know there was, as much as I tried not to read all the comments and Facebook and such, it was hard not to. And I saw that there was quite a bit of confusion about what happens if a student or a teacher, for that matter, has a positive test, and what are the consequences flowing from that. Talked about flow chart or something.
Yeah.
And I think if we could just make that very clear to all the parents out there, so they can look at it themselves and understand it.
Yeah.
So there'd be a lot of request for that.
Yeah, so there's some challenge around this. There are flow charts, and Julia is, certainly probably the most versed in these. There's flow charts for what you do procedurally if somebody is test positive in the school environment, whether it's staff or student, and it walks you through going to the nurse, going home, getting, it walks the individual flow chart scenario of if this, do that. What does not exist, and superintendents have been advocating since the spring with the state, with the governor's office, with the Department of Health at both the local and state level, they have not given us a flow chart for decision making with regard to school closures. And I know that seems crazy, and it is crazy, but that's the reality. And that is something that unfortunately that is leaving all districts in positions like we are now. If we get a case, it is somewhat simpler because we do have the flow chart of where those quarantines will lead us. Student quarantines, we have this easy solution of remote learning. If we wind up in a situation of staff quarantines, we're going to have to make a judgment call as to whether we have enough staff to run a school or not. So that's something that there isn't a metric around, and it's going to be different based on which building you're talking about. Or if we're in full remote already and we have teachers quarantined, that actually doesn't make a difference because they're already home. They can teach from home as long as they're not sick. That will not make difference. But there is no flow chart for determining school closures that the Department of Health has provided, unfortunately.
Well, and at the university level, my understanding is, obviously there's all these positive asymptomatic cases because they're testing these kids as they're bringing them back. But if they can find like a common thread, like a particular dorm, that's easier to identify. I mean, obviously you have to quarantine if you test positive, but if you were to get to a point where you can't, like the cases are everywhere and there's no exact connection to it, that would be sort of the catalyst to shutting the university down, let's say. And I don't know if we would ever get to that because we're set up differently, but in our case, because we have certain cohorts and we have certain classrooms, in theory, the contact tracing is that much easier,
Right. And that is a lot of the theory. There's, the cross-contamination is the theory behind cohorting as well as contact tracing. Ideally, again, if we get a case, one case should not shut the district down. It should ideally be school specific, unless we then get siblings or shared staff that then take us into multiple buildings.
Well, if we have an outbreak.
Yeah, we have an outbreak. I mean, we could have a scenario where, say, a traveling specials teacher is in 2 different buildings, and they become, symptomatic, or they're identified as they test positive, and now they've been with 6 different classes at 2 different schools within the contagion period. Then that could cause a lot of student quarantine as a result. It may not it could span 2 buildings. I don't know that would be considered an outbreak because it's one person, but it certainly has the potential for one given.
So, I mean, there's so many different scenarios you could possibly imagine.
Yeah.
But it occurs to me that this is relying heavily on, robust contact tracing, very robust contact tracing, timely manner. We have a commitment from the county that they can provide that.
Yes.
Proof's in the pudding. The proof is in the pudding.
Exactly.
I mean, again, in our school system, though, this is pretty easy to do, right? Because we know when kids have been in school, which classrooms they were in, which rooms they might have been in, if they were in the cafeteria. And the other thing I want to emphasize here, too, is I know we're thinking about worst case scenario. However, I want to emphasize for the public that we are taking a belt and suspenders approach. In theory, I mean, masks are required because the rate of transmission is super, super low if both parties are wearing a mask, even if somebody's infected. And we have the dividers up where you can't be socially distant. So I know there's still a lot of unknowns about this illness and this virus. But at the same time, like, we're taking every safety measure. So even if there were a case, we'd have to then be extra safe and go through this quarantine and contact tracing process. However, I don't want parents to feel like they're sending their children to school and they're just going to get, infected or be at high risk.
But I think it's clear from this whole incident that we can do what we can do, but the community has to step up and rely on other people outside the community to help us with this situation.
Definitely, because to your point, our infection rate as a village or as villages or a town could go up beyond the school walls, and that would affect us too. So,
I just, Dr. Champa, I just want to clarify. So I understand that the New York City schools have created a metric that if they have 2 positives in a school, they will shut down. But that was their choice. That wasn't given to them. So
Correct.
We're waiting for direction, or we'll have to just assess each situation as it comes up.
That's where we are at this point. I mean, certainly if you'd like to see us go down that path, we could have some of those discussions. I think I guess what I struggle with, there's so many unknowns, and each case is so unique and specific. I would hate to lock us into a position of something that maybe we didn't need to do.
I agree. I just wanted to make sure people who were listening, who might have heard what was going on in the city, don't think that is a state mandator in any way.
No, not at all. No, that's definitely a district decision, and certainly they're a whole different scale of district.
Right. Thank you.
With whole different problems.
Yes.
So I guess, Dr. Champ, that the lack of requirement or guidance around closing leaves uncertainty, but it sounds like the message to the public is we're committed to getting kids in school and to keeping them in there. And we're hoping that everybody will join us and act responsibly so that we can keep going with that. And our district is small, and with the shared staff and siblings, we really have to make sure that everybody is on the same page about being responsible.
Yes.
Not that we haven't said that before, but thought I'd say it again.
Yep. It's perfect time to say it.
There's been a large financial commitment to getting kids back into school and hundreds and hundreds and hundreds of hours of planning. So that is ultimately the goal of everybody here. We just want to do it the right way.
And Cheryl, will we hear from Dr. Berkowitz in terms of the next step?
Yes, as I said, we're nailing down the logistics of testing, hopefully this afternoon. And it may take him a little time to get the schedule developed for the staggered testing, but you should expect to hear something from him over the weekend.
Okay, thank you.
You're welcome.
Do others have, go ahead, John.
I just wanted to make one final comment, then I'll shut up. Cheryl's been saying from the beginning that this is a very fluid situation, and we may have to make difficult decisions on in a heartbeat. And if you want to see it as a silver lining, perhaps it's not a bad thing that we were faced with this early in the school year, and we're able, and sort of have strengthened our decision-making process in terms of how to deal with it, and on our communications with the public on how we intend to deal with it. But you've been saying this all along. This is a very fluid situation. It could change day to day. So I think this has made it very clear to people who that is, and how everybody needs to understand that, we're to a great degree, we hold our fates in our hands in terms of keeping this under control. And that's all I'll say. I'll go mute now.
I agree with you, John. And in addition to that, I know the planning on all of this to the community may feel haphazard at times. I think it's because, the reopening of school this year was unlike any that anybody has ever experienced in terms of those who are hired to do this work. And the information that we needed in order to make key decisions didn't always come when we needed it. So I think while this is a fluid situation, the rollout of how to open school and how to communicate how we're opening school and the details of opening school are just the same. It's a very fluid situation, and we don't have all the information we need exactly when we need it sometimes. So just want to emphasize that. Dr. Champ, can you, I know does anybody have anything else to add on where we are with this? I just wanted Dr. Champ to speak to the financial reports that are in front of us before we take a motion on them. Did somebody have something, Leah?
I had a quick question. Cheryl, the testing people are bringing enough staff that they don't need anybody, not to open another volunteer can of worms, but they don't need any help from us as far as staffing the testing.
No, they'll be fully staffed.
Okay. So I also wanted to just say to what John and Jess just said, that from behind the scenes, whatever view that we have had with the planning for reopening all summer long, although it has been fluid, it has been incredibly impressive how the administration has put this plan together, and then being in the school, seeing a little bit of the work that was done over the summer, which we talked about at the last meeting. I'm very proud of our district and very excited for the kids to see how ready we are for them to come back.
Thank you, Leah.
Perfectly said.
Okay. All right.
Okay, so could you just reference, there were two prongs to this meeting. One was to give the public an update on where we are and for the board to be able to discuss this before the communication goes out, but also related to that, there are these two financial motions that we have to make regarding the testing. Or do you want Jim to speak to?
Yeah, I'm gonna actually ask Jim.
Do you want me then to wait and take the motion and then have Jim, when we do comments, add? Is that easier? That's the way we normally do it. I just didn't know if you want to speak to that. Okay, sorry to go out of order. So section 2 is financial reports and motions, and I'm going to take a consent of 2.1 and 2.2. Do I have a motion? Jim showed up on my screen, but he's not allowed to take a motion for this school board. Thanks, Eileen. Do I have a second? Thanks, Vinny. Okay. So Jim, can you give us some background on these two motions?
Yes, thank you. Both of these are obviously related to why we're meeting here today. The first one has to do with for a waiver of public bidding. General municipal law requires public bidding, certainly for items of this magnitude, for the cost of this testing, the service for this testing. In this resolution that you see here, the board is declaring that they were going to waive public bidding as a result of the declaration of emergency related to COVID-19. In normal circumstances, we would put out an RFP or a bid for a service, or for professional service, we would put out an RFP. We would publicly advertise for it. This would take weeks for it to happen. In this instance, certainly we don't have the time for weeks for this to happen. And because we're looking for that quick turnaround time of 24 to 36 hours for those test results, that's why we want to be able to do that, and we want to make sure we're in bounds with with public law and the general municipal law. So that first item there is exactly that. It's for the waiver of public bidding. And as you see, that resolution really spells out, it's for goods, materials, and service, supplies, materials, and services. The second item is to allow the superintendent to enter an agreement with Westchester Medical Center for the COVID-19 testing services. Final contracts, again, things are happening very quickly. So we don't have the final contract right now. In broad strokes, what their fee is, it's $108 per test. They will first bill the patient's insurance company for those costs not picked up by the insurance company. The residual costs will be picked up by the district. And speaking with them, they are seeing insurance companies picking up anywhere between $52 to $75. So in this range, or magnitude that we're looking at for one range of testing, could be in the magnitude of about $50,000. Now you'll see this is for an amount up to $100,000. I'm just a finance guy. Glass is half empty. I always look at things. What if nobody pays anything? What would it be? And that's kind of the high range, the upper range cost of what that cost could be. But in my conversations with them and what they've shared with what their experience has been, I think we would expect that cost to be in the range of about half of what the total cost is, about half of it being picked up by people's insurance companies.
Jim, I have a question. Not being totally savvy as to how everybody's insurance works, but let's say, for argument's sake, somebody hasn't met their deductible and they would be paying out of pocket for this. What happens in that instance?
Well, that's a great question. Dr. Champ and I talked about the same thing. I know many people have high deductible health plans. So that's not a cost incurred by the insurance company, and that, in which case the medical center would forward that cost to us.
And Jim, with the $108 per test, that's the only fee. There's no flat fee for having them come. It's all captured in the 108.
Yes, that's captured in the 108. And thank you for bringing it up. It reminded me of, again, I was talking about Quest. Their fee was $130 per test. And we would have to do it. That was without them administering the test. That was with all personnel administering it.
Yeah, that would work.
So
let's not do that.
so again, as we look at, I always like to triangulate a little bit on costs. Once I heard that Quest number and knowing they're a large, national firm, certainly that $108 is better than the $130, as you know, and it seemed to be in the reasonable range.
So just to be very repetitive, there will be no cost to parents.
That's correct. The medical center will first try to bill it through the patient's insurance company. Those costs not picked up by the insurance companies will be picked up by the school district.
I guess one other follow-up, I mean, this kind of goes backwards to the schedule that we're holding, but they've told us that they can do the testing turnaround in 24 to 36 hours. But we are, kind of holding on that. And if cohort B can't all be tested on Monday, that could impact the Thursday date potentially. Or if the tests don't come back after.
Yeah, that's really what would impact it. We're pretty confident that we could get all of cohort B tested on Monday. There may be it may be a later schedule they're going to have to set up in the morning, so it may be something more along the lines of like from noon to 7 p.m. on Monday. But they are capable. They do have the capacity to test 350 students or individuals in one testing day. So we're pretty confident we can get the volume tested. It's, to your point, it is just contingent on the return of results. So,
okay, thanks.
Yep, you're welcome.
Okay, any other questions or comments? Okay, all in favor? Was there somebody? It's hard to hear. Okay, all in favor?
Aye.
Any opposed? Any abstentions? This brings us to section 3. This is Ms. Miller's moment.
You're muted.
I was like, is it me or her?
It was me. Sorry. Madam President, would you entertain what do I say? A motion
Motion to
adjourn. Sorry.
So moved. Do I have a second?
Second.
Thank you, Sue. All in favor?
Aye.
Any opposed? Any abstentions? Thank you, everybody, for pulling this together. It's a good way to end the week, a nice path
Yes,
forward.
thanks for pulling it together. Great job.
And the
Good to-
communication will come out from the district for anybody who wasn't able to tune in shortly?
Yep, hopefully within the next hour.
Okay, great.
Thank you.
Thank you.
Everybody. Have a good
Great.
Thank you very
weekend.
much.
Look forward to
Bye.
seeing the elementary and middle
I
school kids
know.
on Monday.
I know. Alrighty. Thank you.
Bye.
Bye.